to be honest, bringing Solea into the office started as a free steak dinner. Looking at the price tag, I was kind of like, but this, I don't know. And we walked out of the restaurant. My wife was like, this is something that you have to do. And coming out of residency, being a pediatric dentist, having a new practice, just trying to find new avenues for what is going to set our practice apart from others. And having the opportunity to bring something in that is going to provide a better experience for the kiddos that we already had as patients, in addition to adding new abilities for procedures in the practice, was just something that felt like I couldn't look past. So I have 4 daughters, 6, 3, 2, and 3 months. And with our 6-year-old, my wife worked overtime trying to feed her, always on the pump, and not being able to fully breastfeed her was something that she took really heavy. And not knowing anything about tethered oral tissues in dental school and residency. And then baby number 3 came along, and we released hers at 5 weeks, and she is 2 and still now tandem feeding with the 3-month-old. And so going from a point where she struggled so much with breastfeeding, and then getting to the point now where she's basically supplying 2 kiddos with milk, just seeing that transition, now working with countless moms each and every day, the ability to provide that dyad relationship, that breastfeeding journey, is just something that's been so impactful to me. And my wife saw how much that it just lit me up, because I think that being able to foster that relationship with mothers and their babies is just, it's wonderful. It's a beautiful thing. Moms that come in that are telling me that they're in toe curling pain, 7 out of 10 pain, blister, chapped, lipstick-shaped nipples, baby's not transferring, and then you do the release and they're just like, oh my gosh, I didn't know this wasn't supposed to hurt. And after she gave me a hug and was like, I never thought that breastfeeding was supposed to feel this comfortable. Using the Solea in terms of hard tissue and how that's made a difference is, coming out of residency, it was, if kiddos had 6, 7, 8 cavities, it was almost like an automatic pass to the hospital for sedation. Now, with the Solea, my associate, Dr. Joe, and I, it's become much easier to get half the mouth done in one visit, half the mouth done in the other visit, and we don't have to do any shots. We're doing a lot more chairside dentistry with the laser, getting a lot more done in single appointments. And so not only are we saving the parents the stress of having to go to the hospital and put their kiddo to sleep, but we're also saving them the stress of having to take off work, having to take the kiddos out of school as often, because we're getting more work done in individual appointments. With the growth of the business, more patients coming allowed me to bring on an associate. And when I started thinking about bringing the associate on, it's like, we have so many families that want to come and see us because we use laser. And it was going to be awkward if they came to see me, but I was booked up in one room and then they were going to see Dr. Joe in the other room and I didn't have a laser in there. I'm well into my journey with Solea and understanding how to use it. So being able to be a mentor for Dr. Joe coming into the office, it's like you get that in-person training with the laser when you first start, and then you get some virtual training, which is really helpful. But having someone standing over you telling them the tips and tricks that have worked for them, I think has made his transition into using it just double time of what it was for me, which has been great.